Hello, and welcome to a practice management update from MedChi. Today, we're going to be talking about opening a new physician practice with Kate Gilman from Medical Business Partners. And we're really excited to have Kate here with us today. Kate and her partner, Julia, have been working with MedChi for quite some time now, and they have incredible experience. Kate's been working in the healthcare industry for over 20 years. She's an expert coder, compliance officer, trains physicians all over the country. She's really good at recovering coding inefficiencies, billing problems. She can train staff, works on compliance. It really does work for physicians in practices of all settings. So she's the perfect person to help us understand how to open or close a practice, physician practice here. And I really appreciate Kate, you being here with us today.
Thank you.
So Kate, one of the things that we hear often is that people aren't doing private practice anymore and it's dying. But actually, we do have a fair number. It's obviously not as big as it once was, but we do have a fair number of docs who are asking for information about how to open a practice. And I have here on this slide information from MedChi, the Maryland State Medical Society, and I'm the CEO of that organization, that's open to the public, that kind of gives some guidance on opening and closing a practice. But I really want to focus on opening today because we have been getting physicians who say, I'm just sick and tired of working for the hospital. I'm sick and tired of working for the large corporate entity. I want to open my own shop up. And I was hoping maybe you could help us answer some of the questions that a doctor who's thinking about opening a practice that they should consider. So I guess the first question is, what should doctors consider when they're opening a practice?
So, all healthcare practitioners, regardless of their specialty, when considering opening a new practice or expanding and growing their existing practice, need to remember that success is not easy and it's certainly not for the lazy. It is the result of preparation and hard work. There's so many different aspects to successfully practicing medicine. They should come up with a plan on how they envision their practice and approximately where geographically they want to be located, and then start doing the research on the right team who can help support that vision and turn it into reality.
So let's talk about the team. Who are the members of the team that the physician needs to consider to assist them with the setup?
So they should talk to a legal counsel, not only to set up the operating agreement, but also to review if there are any non-compete items to worry about if they're leaving a practice, or what services can or cannot be offered to patients altogether. Another great resource would be a CPA firm to make sure that the entity is properly set up. I would also recommend looking into consulting firms that offer practice management services so they could guide them on proper infrastructure and what other pieces need to be put in place, such as location, whether it would be an existing space or build out, proper IT setup, inventory, staff, malpractice insurance, marketing options. And they definitely should reach out to local medical societies such as MedChi for assistance in finding these resources.
So,
One thing that I would highlight would be that providers should hire someone with a healthcare experience because there's so many nuances in the healthcare space that can be overlooked by those who don't have it.
so it's important to hire experienced staff. What
Yeah.
kind of training should the staff be going through?
So remember, your staff will carry out your mission statement and will help you grow your practice. So if you don't invest in your staff and don't offer the training and also don't communicate with them on frequent basis, this will cause unnecessary issues in the practice. For all new hires, you want to make sure that in the healthcare space, they will go through the basics, such as OSHA training and HIPAA training, and that they also have a great understanding of your internal practice operations. If the protocols are not set in place yet, um, maybe you could have your staff help you develop them and put them together. And this goes back to hiring experienced staff. Yes, it would be more expensive and it would cost you more money, but it would eliminate headaches because their experience can help run the practice more efficiently, reducing that administrative burden from the practitioner so that they could actually concentrate on practicing medicine.
So, okay, you've kind of, if you look on the MedChi website here, we have a checklist for practice setup. You've gone through the checklist, you found your spot, you've identified your staff, you're about ready to roll and open up, and it's time to go talk to the health insurer. So, can you talk to us a little bit about how credentialing works with the health insurers? How do the payer contracts work? Can you talk a little bit about that for a new practice? And what do the docs need to consider? What help do they need? How does a doc deal with those types of issues, and who can help them?
Sure. So credentialing process is a process of enrolling practitioners with federal and commercial payers. You want to make sure that all of your documents are in place, that your CAQH profile is updated and attested for commercial payer participation, that you have an ePrep account that is created properly and set up properly for Medicaid participation. You want to make sure that the portals such as PICOS, INA, NPAS are properly set up and updated so that you could properly enroll yourself in your practice with Medicare. The timelines of the credentialing process is important as well. Federal plans will usually process application anywhere between 30 and 90 days, but commercial plans might take up to 120 days, maybe even longer, after they take the additional time to go through the submitted application. And if something is not submitted right away, it might postpone the enrollment process even longer. So you want to work with someone with experience who will want to fight for your contracts and follow up constantly with payers so that they would backdate the effective date, so they would potentially increase the fee schedule for your contract. Unfortunately, even though the practitioner might be established with payers through the other entity, through the other employer, and have been for many, many years, their new contract through the new entity might be significantly lower in rates because to payers, especially commercial payers, this is a brand new entity that needs to build up leverage in the healthcare space. But I wouldn't get discouraged. The first year, you might need to commit to what they offer, but when it's time to negotiate the contract, you can go back and ask for a higher reimbursement.
And so, obviously, if you're listening to this and you've been employed and your employer's been taking care of all this stuff, it could be a little too daunting. But again, your medical society, professionals like you, and I know you and Julia set up a lot of these practices, can really help a practice get up and going. And once you understand kind of the nuts and bolts, it's very doable and it's very possible. Kind of to close it out, I was wondering if you could just give some general advice for physicians who want to start their own practice, and what do you see as like kind of the next steps?
Sure. Starting a new practice can be overwhelming, but it doesn't have to be. Do your research and surround yourself with experienced resources in healthcare that can help you build your dream. Um, just like Jean mentioned, MedChi has a lot of wonderful resources that could help you. And medical business partners here, we could also help and talk to you initially to kind of understand where you are, what you want to do, and where you want to be, and see if we could recommend some solutions for you.
Well, thank you for joining us today. Again, you can find more resources at www.medchi.org. And we can have, if you reach out to MedChi, we can have you talk directly to Kate or someone else who can help you begin this journey. Thanks again.